the late stages in my pregnancy, I think it was around week 35 or 36, I developed preeclampsia. And it wasn't severe, so the doctors kind of treated it as like a, let's just watch and wait and see what happens. I had protein in my urine, but I didn't have any issues with, blood tests or anything like that. So they felt like it was stuff we could just watch and wait. So I didn't have any big complications with it until labor. That's when they started seeing some issues with my blood work, and my blood pressure skyrocketed, my whole body swelled up, that kind of thing. So that's what happened with the preeclampsia. With Jonah's labor, I was not progressing, and my water had broke at 1 o'clock in the morning. We went in, I wasn't progressing. They kept checking my cervix, repeatedly through the day, and I developed chorio, which is a uterine infection because of that. And so I think I spiked a fever, and at some point it was decided that he needed to be delivered emergency C-section because his heart rate was doing some very strange things. Also, I forgot to mention, through that day, while I was in labor, it was like a 12-hour process before I developed the infection. But I had a penicillin drip, an IV, because I had tested positive for group B strep, which is something they test you for when you're pregnant. Because if you test positive for it, then you have to be on penicillin until the child is born, basically, once you go into labor, to make sure that it's not passed to the baby during birth. So I was on penicillin for almost 12 hours and then ended up with emergency C-section. Jonah was born and went to the NICU because he had fluid on his lungs that took about 4 days to clear. And at that time he was put in the specialty care unit rather than the NICU. So we were there for about a week. And then discharged. I mean, we didn't notice anything, that was super evident with him as a newborn. Thinking back on it now, I think there's some things that I would have realized had I known. He had a lot of problems with digestion as a kid, or as a newborn. He went back and forth between, having really bad constipation and diarrhea. He had a lot of trouble going to sleep. It took, an hour or two at times to get his little brain to shut down. And I think that was some of the sensory stuff that we see with him now was actually happening way back then. But we just didn't know how to recognize it at the time.